Imagine feeling a sense of dread, panic, and discomfort at the mere thought of going on a trip. The idea of boarding a plane, getting on a train, or even driving a car fills you with anxiety and fear. This is a reality for those who suffer from hodophobia, the fear of traveling. Hodophobia is a specific phobia that can have a significant impact on an individual's life, limiting their ability to explore new places, visit loved ones, or engage in travel-related activities. In this episode, we will explore the causes, symptoms, and coping strategies for hodophobia, shedding light on this often overlooked and misunderstood condition. The term hodophobia is derived from the Greek words hodos, which means road or journey, and phobia, which means fear. Hodophobia can manifest in various ways, including fear of flying, or aviophobia, fear of driving, amaxophobia, or general fear of trains, buses, boats, ships, or even the fear of traveling by foot. The causes of hodophobia can be complex and multifaceted, often stemming from a combination of genetic, environmental, and psychological factors. One of the primary causes of hodophobia is a history of traumatic experiences related to travel. For example, a person who has experienced a severe car accident or traumatic event during a trip may develop hodophobia as a result of associating travel with danger or harm. Growing up in an environment where travel was limited or discouraged, or having overprotective parents who instilled a fear of travel can contribute to the development of hodophobia. Negative influences or traumatic events during childhood related to travel, such as being lost, getting separated from family members, or encountering a travel-related accident, can also trigger a fear of traveling in adulthood. The symptoms of hodophobia can vary in severity and may manifest both physically and psychologically. Physically, individuals with this fear may experience symptoms such as increased heart rate, shortness of breath, sweating, trembling, and nausea when confronted with the prospect of travel. These physical symptoms are often similar to those of a panic attack and can be distressing and uncomfortable for the person experiencing them. Psychologically, hodophobia can cause intense fear, anxiety, and distress related to travel. The fear of traveling may result in avoidance behaviors such as canceling trips, declining travel invitations, or making elaborate plans to avoid travel-related situations. Hodophobia can also lead to a significant decrease in the quality of life, as it may limit the individual's ability to engage in work-related travel, visit loved ones in distant locations, or participate in social activities that require travel. Hodophobia can sometimes manifest in specific forms, such as pteromerhanophobia, which is the fear of flying, or dromophobia, which is the fear of crossing roads or traveling by road. Coping with hodophobia can be challenging, but there are strategies that can help individuals manage their fear of traveling. One of the most effective approaches is gradual exposure therapy, which involves gradually exposing oneself to travel-related situations in a controlled and supportive environment. This can start with small steps, such as looking at pictures of travel destinations, watching videos of people traveling, or taking short trips to nearby places. Over time, the individual can gradually increase the level of exposure, such as taking short flights or train rides, until they become comfortable with the idea of traveling. Some studies also indicate that managing or limiting caffeine intake may affect severity and the impact of hodophobia. Firstly, caffeine is known to stimulate the central nervous system, which can increase alertness and arousal. This can lead to heightened levels of anxiety and stress in some individuals, as the increased alertness can amplify feelings of worry and fear associated with traveling. It is, of course, important to note that the effects of caffeine on hodophobia may vary from person to person. Cognitive behavioral therapy, or CBT, is another effective approach for managing hodophobia. CBT involves identifying and challenging the negative beliefs associated with travel and replacing them with more rational and balanced thoughts. Relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can also be helpful in managing the physical symptoms of anxiety associated with hodophobia. In some cases, medication may be prescribed as part of the treatment plan. However, medication should only be used under the guidance of a qualified healthcare professional, and it is typically used in conjunction with therapy and other coping strategies. Building a support system can also be beneficial. Talking to trusted friends, family members, or a therapist about their fears and concerns can provide emotional support and encouragement. Joining support groups can also provide a sense of community and understanding, as the individuals can share their experiences, coping strategies, and offer support to one another. It's also important to remember that setbacks may happen, and that's okay. It's essential to practice self-compassion and not be too hard on oneself during the recovery process. Phobias are real psychological conditions that cause distress and impairment and should not be dismissed. Please subscribe and share so we can help spread awareness. If you or someone you know is struggling with anxiety or a phobia, seek help from a qualified mental health professional for evaluation, diagnosis, and treatment.